quite impossible to live without internet, because it is very useful in laptop, desktop, tablet, smartphone, for easy communication and transactions, to connect globe, all over the globe. If we would like to find any topic, or if you would like to study any new topic, suddenly we give the topic in Google, and Google search can give each and every information, updated information till date. For example, one person is here in India, another person is there in another part of the world, like Germany. How they will communicate? They will reach each other by video conferencing, conference calls, everything it is possible. And world statistics says that India stands second position in surfing internet, accessing the internet. Around 900 people using internet. Now you see, where does internet use? Smartphone, tablet, laptop, desktop. Early ages, in early adolescence, like in the class 5th 6th standard students, they are eagerly, they have great affinity, they are very eager to use the smartphone, tablet, laptop, desktop, and surfing internet. Why? For getting the online informations, online marketings. They are watching the movies, pictures, objectionable videos. They are using the different social medias like Facebook, WhatsApp, Instagrams. People are doing dating, cyber relationships, online relationships, and even the people are crazy to hack the ATM informations, different laptop, desktop information, smartphone informations, which are called as cyber crimes, hacking through internet, through programming. Now, do you know what would be the side effect of these kind of problems? These kind of problems, when the people are very crazy to do this abnormally, excessively, out of control, then they will be under the trap of internet addiction disorder and internet gaming disorder. Now, how can we know that one person is under the trap of internet addiction disorder, internet gaming disorders? Some symptoms will come, physical symptoms will come. What would be the symptoms? Loss of appetite, loss of patience, depression, mental irritation, headache, attention deficit, loss of temperness. Even, for example, after having dinner, we go to the bed, and for example, if eyes open in the midnight for toilet, then the people are going to toilet and opening their mobile, checking the WhatsApp, Insta. What does it symptom? This symptom indicates that that person is under the trap of internet addiction disorder and internet gaming disorder. Very alarming situation. Now you see, our normal brain, how does our normal brain function? Our normal brain function through normal signal transduction. How? By the utilization of secretion of different neurotransmitters, like dopamine, 5-HT, 5-hydroxytryptamine or serotonin, acetylcholine, gamma aminobutyric acid, N-acetyl aspartate, and different ions like calcium, sodium, potassium, magnesium, different ions, chloride ions, different ions. Now, what are the importance of this neurotransmitter for the normal brain function. Dopamine is happy neurotransmitter. It is responsible for giving the mental happiness. 5-HT or serotonin, this is responsible for attention. Acetylcholine, irritable neurotransmitter, excitable neurotransmitter. Gamma aminobutyric acid, inhibitory neurotransmitter and responsible for keeping the mental feelings. N-acetyl aspartate, NMDA receptors, and these neurotransmitters are very important for our maintaining our normal brain function and the memories. Now, due to excess operation of this smartphone, tablets, laptop, desktop, internet surfing, when the person is under the trap of internet addiction disorder and internet gaming disorder, then CT scan was done, different blood profiles were, blood testing were carried out, and the CT scan says that abnormalities found in their mental status. How? This kind of patients, they have many problems like, dopamine is getting more release at a high level, whereas there is a loss of serotonin and aspartate synthesis at the serotonergic neurons. So this kind of, hyper level of neurotransmitter dopamine, lower level of 5-HT, hyper level of acetylcholine, lower level of aspartate synthase, these kind of issues when appear and it persists for a long time, it silently goes the trap of internet addiction disorder and internet gaming disorder. Now you see the report, 55,507 pregnant women was tested in different countries like Denmark, Netherlands, Spain, South Korea. And it was found that, so these kind of ladies, when they are under pregnancy, they have high affinity, great affinity to operate the smartphones and tablets. But they did not know they are under the trap of internet addiction disorder. What happened? Problem is premature baby birth or short-term pregnancy. Big issues. Now you see, the baby is under the is on the breast of mother, baby is sleeping, but mother is operating the Android mobile tablet. What kind of problem will appear? Behavioral problem of the babies, late speaking, stammering problem, hyperactivity, baby is crying because mother does not know that the radiation emission spontaneously from the Android mobile hamper the skull of the baby and hamper the neurotransmitter of the baby's brain. That's why baby is does not able to start speaking, does not able to give attention, normal activities. Now you see, mother is doing breastfeeding to the baby. In that condition, how does baby start to speak? Baby start to speak with mother. When mother is doing breastfeeding to the baby, mother is talking to the baby, whole attention should be on the baby, but mother does not attend the baby, mother is busy with the tab and Android mobile, so attention is going to loss. There is a communication gap between the baby and mother. So such kind of activities negatively impact on the baby's mental status. Baby is does not able to speak, and immunity development problem started. These are all reported. Now you see, when a person is taking food, all the systems of the human, all the organ systems of the human get activated. Now you see, baby does not want to take the food, baby is crying, but baby is very happy when the baby is operating mobile and taking food. Now you see, when the baby is operating mobile at the time of intake of the food, is it good? No, because baby is watching the movie, or baby is watching the something else, short movies, cartoons. Brain jam, traffic jam into the brain occurs, and what baby is eating, that baby is unable to taste the food. The baby does not want to enjoy the food, rather enjoying, very much enjoying the mobile, what it is going on there on the screen. These kind of activities very harmful for the baby, and baby's immunity will be poor, because later on baby will not, does not want to take food until and unless if you provide the mobile. Means when you provide the mobile, then only baby is taking the food. So there is a big communication gap, intake of the food and baby's wishes. So baby's normal neurological systems is getting disturbed. Now you see, baby is very happy with the mobile. You see, the mobile is on the right side, very close to the lungs. If the mobile is on the left side, very close to the heart. So, the mobile is ringing or the mobile is vibrating. This extra vibration is very harmful for the heart, or the heating which is generated, that heating and radiation, it hampers the baby's listening problem, neurological system or audio systems through the ear. That is very, very much dangerous. And now you see, baby is sleeping, all around some laptops, internet devices, mobiles, Android mobiles are present. So baby is sleeping under the trap of radiations, which are very, very dangerous. Now you see, parents are sleeping, but baby is not sleeping. Under the blanket, baby is watching something through the tablet or mobile. It will pressurize on the retina. It will hamper the vision. It will hamper the sleeping time. Everything will be getting disturbed. Now you see, the frequent phenomena happen. Husband, wife on the bed, both are very busy with the mobile. They are not doing normal activities, means normal talking with them. In the college life, college life or university life is the best life of whole life. The students, young students, they are not talking with each other. They are not discussing with the study what classes held today. What they are doing? They are very busy with their mobile or tab. Now you see, during the study, if mobile is there, definitely attention deficit and student wants to open the Instagram or Facebook or WhatsApp during the study as well. During the driving, when they are driving bicycle, motorbike or car, they have their internet serving, or they have their devices with them, mobiles with them. They are doing operation, they are talking. So these kind of activities are very, very dangerous. Why? Because they are lacking their contact, they are lacking their attention, they are detaching from the society. Now you see, for the young baby, what would be the problem? Hyperactivity, lot of attention, late speaking, stammering. For the child, communication problem, skill problem, loss of appetite, trafficking of the jam into the brain, trafficking of the memory, loss of the memory. For adolescents, vigorous behavior, dangerous behavior, loss of the memory, loss of mental stability, loss of sleeping disorder, loss of attention. For the adult, loss of patience and control, headache, shoulder pain, neck pain, social detachment, loss of attention, loss of efficiency in the work. Now, how does abnormal signaling happen, and how does abnormal signaling responsible for internet addiction disorder and internet gaming disorder? My student Bhumika Chauhan, so she has done one study, and this study published in Current Signal Transduction Therapy in 2020. Now you see one important field study we have done. One important field study my student Bhumika Chauhan has done in Kashipur. So what we did actually, we have planned to visit in college, in schools and in coaching centers where young students from 15 years to 18 years or 22 years old students are studying. You know, so in Udairaj Hindu Inter College Kashipur, GGIC Kashipur, Guru Nanak Girls Inter College Kashipur, Krishna Public College at Kashipur, Pandit GB Pant College Kashipur, Tularam Rajaram Institute Kashipur. So in Kashipur areas, some schools we have visited. Date are given, and 60 students, 32 students, 48, 16, 53, 60, 95. So this much amount of the students we have interacted, and this is the age group, you see, 16, 14 to around 17. Now we have given a questionnaire with permission of their bodies, governing bodies. What questionnaire it is? First, we have delivered a talk. How does this kind of issues arises? How does the smartphone tablets hamper negatively? And then first half an hour talk, discussion, free discussion. Then we have given a questionnaire, written questionnaire to them. And they have replied, you see, out of 60 students of the Udairaj Hindu Inter College, 25 students, they are suffering from eye pain, headache, loss of attention, short of the temper, and 5 students, they suffer from depression, loss of appetite, one student sleeping disorder. Like that, you see, in this institute, this kind of students, they have problem with this problem, and this much of students, 5, 4, 3, 1, 1, 2, 13, they have depression, loss of appetite. And you see, students, incredible number of students have their sleeping disorder. So now you see the field study, how it is important. Then you see, we have done the study, Adarsh Inter College in Bijnor, Chaudhary Jospal Singh Sarak Inter College in Bijnor, RK College in Moradabad, KK Coaching Center in Bijnor. Incredible number of students, they are suffering from sleeping disorder, depression, loss of appetite, eye pain, attention deficit, and shortness of the temper. And you see, this study, field study, because this Bhumika Chauhan, Jyoti Durga Pal, they are my project students, did MPharm under my supervision. And this study, the name of the article, school-based prediction and prevention of adolescent internet addiction towards touchscreen mobile by motivational therapy, published in EC Pharmacology and Toxicology Journal in 2020. Now you see, this is a great loss, because youngs are the spinal cord of the family, and young students are the spinal cord of our country. So before going into the reality, they suffer from this kind of problem like attention deficit, high temper, depression, loss of appetite, sleeping disorder. They don't know that due to use excessive affinity for the use of the mobile and laptop and tablet, they are under the attack of internet addiction disorder and internet gaming disorder. Now you tell, what would be the solution? They are quarreling, they are fighting with the parents, they are fighting with the seniors, they are fighting with their respected elder brothers, elder sisters, uncles, auntie. What would be the solution? Does it have any solution through proper medicine? No. There is no medicine if a patient is suffering from internet addiction disorder and internet gaming disorder. Now you know, mother gives us birth. There is no substitute for the mother in this world. Scientists try to find out the medicines through the nature. Who is our mother? Nature is our mother. Does it have solution in the nature? Yes, we have. Through the study, scientific study, it was found that, these phyto vegetables like bitter gourd, broccoli, bell pepper, spinach, tomatoes, apples, cabbage, pumpkin, these kind of vegetables and fruits, they contain the vitamin C, they contain the vitamin K. These are all antioxidants and these are rich sources of sphingolipids, zinc, iron, magnesium, copper elements that nourish the brain, that can restore the brain function and gives neuroprotection. So once again, I would like to remind you, when a patient is under the attack of this internet addiction disorder and internet gaming disorder, there is no medicine. And these kind of vegetables we can take for restoring the brain function. Now, so what is the conclusion of this study? Because there is no medicine, we are losing our youth generation talent. So creating awareness and verbal therapy, counseling therapy, so that our young generation will not be under the attack of internet addiction disorder and internet gaming disorder. In the school, the teachers and seniors, they should interact with the young students. They should give counseling therapy, creating awareness. We did it in 2019 and 20 field study, going to different part of the Kashipur, Bijnor, Moradabad, and we interacted with the students. We gives counseling therapy, creating awareness to the young students for not under the trapping of internet addiction disorder and internet gaming disorder. So this is the conclusion of our study. For a short, we have a lot of collaborators and doctors. This is a doctor. He is a Dr. Aruni Saxena. He is in United Kingdom, Nottingham University. We did a lot of discussion with the doctors, very good doctors, MD medicine, MD neurologist, cardiologist, even gastroenterologist, because this kind of problem directly attack the gastrointestinal system along with the neurological brain function. And we are very much happy. I am very much happy because my institute, Global Institute of Pharmaceutical Education and Research, gives a lot of facilities and creating favorable environment for the research. I always give salute and lot of regards to my mentors, Professor Dr. A.K. Saxena, Professor Dr. Mridula Saxena, and Dr. M.C. Bagchi, who is my PhD mentors. And most important point is, we are the young teachers. We are the teachers. We are really dependent on the young students, because young students, they are doing the work, research work, under the supervision of the professors. They are our young students who are doing the research. And finally, I would like to salute my mother India, Bharat Mahan, and I am really proud that I am Indian. And thank you all for your attention. And the study is open for the discussion. So if you have any query, you can discuss.